It is really my pleasure today to introduce Dr. Zsófia Clemens, Ph.D. Dr. Clemens has a background in brain. I really appreciate you joining me today and sharing your philosophy and beliefs in nutrition, health, diet, and the causes of disease.
Thank you. That's my pleasure to be here. Thank you for inviting me.
Well, it's my pleasure. Where are you? Are you in Hungary now?
Yes, I'm based in Hungary. Yes.
Beautiful. Well, maybe you could tell us a little bit about yourself and how you got into this nutritional world, because that's really what we're in as sort of a foundation of health and wellness, which is opposite. I'm a traditional Western trained physician, and nutrition was never shared in our world as the cause of disease or the cure of disease.
Yeah, that's the same thing applies for me, even if I'm a biologist. As a background, I'm a researcher, and but I've always been involved in clinical research. My workplaces were neurological departments and specifically epilepsy ward. I spent quite some years in epilepsy wards, and I was into researching patients' EEG, electroencephalography, so brain activity, of the disease being healthy, and then I was involved in sleep research too. We set up studies to find out how sleep affects memory and memory consolidation, and so this was my original background. This is how I was trained, and it had not to it didn't have much to do with nutrition or vitamins or whatever, only with disease and medicines. So this is where I started from.
So in your scientific early years, it was the measurement of particular parameters to try to understand the disease. And
yes, it was the diagnosis itself. So the
and
diagnostic part, and that's still okay. There's still not much problem with the diagnostics, and there are great achievements that has been done since I'm not too much into that field. It is progressing really beautifully. The new MRI techniques, the more and more sophisticated electroencephalography techniques, blood works for very specific parameters. All this is very good, and this field is progressing. It is a treatment side that is not progressing too much.
But I'm curious, before we get to sort of the treatment side of the nutrition, is the causative side of the diseases, and maybe those sort of come together in a way. But when did you begin to look at the cause of the diseases, and maybe you can help us explain a little bit the links between nutrition itself?
Mhm. So the starting point was vitamin D, because 10 years ago it was that the vitamin D related research started trickling into standard medicine. So we asked the first question with my then colleagues whether, if vitamin D is known to be so closely correlated with epilepsy, why do not we try to supplement patients with vitamin D, epilepsy patients who are not reacting any anti-epileptic medications, who have several seizures a day? Why not doing this? And then we set up a first very small trial where we corrected low vitamin D levels in a small set of epilepsy patients, and it turned out that in the end we achieved a 40% seizure reduction in patients who couldn't be helped in any other way and suffered disease for a long time and really had severe epileptic seizures. So this was my starting point, and then I started becoming interested in vitamin D and how this is interrelated with many other brain conditions and other diseases. And of course, the next step was the world behind vitamin D, because vitamin D is just one vitamin. Of course, you cannot cure a very complicated disease with one vitamin. It's more complex. And so this is how I started entering the nutrition field. And then I found out that there are ways to change nutrition as a whole. And changing nutrition as a whole is always more important than starting understanding a disease from the single nutrient approach.
And so what was the magic moment that sort of brought you into that arena and thinking about nutrition as a very important component as the treatment and potentially the cause of the diseases?
Mm-hmm. Yeah, it was 10 years ago when I came across the paleolithic nutrition, paleolithic science, as it was very beautifully described in a book of Laurent Cordain. I think he's a big figure behind this movement.
Mm-hmm.
And he was the one who pointed out the importance of intestinal permeability, the role of intestinal permeability behind diseases. And I think that's his major understanding, and that we have to go back to eating a species appropriate diet in the first place to be able to cure diseases. So this was his philosophy, and this is the philosophy that catched my thinking, because I'm also coming from an evolutionary background. This was, even if nutrition itself was not part of my education to any extent, but I think I received a very strong evolutionary, gained a strong evolutionary understanding of life.
What was your undergrad or your graduate teachings? Where did you go to do your teachings?
So now we in Hungary we have another education system than
Yes.
you have in the US. So our building is more general rather than specific.
Mm-hmm.
We are specialized only in the last 2 years, and my specialization was anthropology and medical science, human medical science. So anthropology refers to evolutionary primates. I did primate behavioral ethological research, and I was still vacillating for a long time whether to go towards primate ethology or into medicine.
And so you chose the PhD route in medicine and the scientific research approach versus the straight medical practice. Is that the path for you, or in your particular environment, that because you do offer a lot of medical advice in what you're doing, which, I mean, lots of people are doing that. I'm just curious on how that field works in your particular area.
So I did my PhD at the Medical University, Semmelweis Medical University in Hungary. So I earned my PhD at the Medical University, not my original university. But myself, I'm working with a team. You know, it's not only me, and I'm working with physicians. This is kind of a net of physicians, dietary advisors. So it is not only me who is behind. And whenever we treat and deal with patients, we always dealing with patients as a group. So it is never a one-to-one. There are always 3 persons in the team.
Can you talk maybe about that uniqueness? And I know that's not our typical nature in Western medical practice. And how do you think that's had more value? And I think it sounds that way, that maybe we're able to see it from different angles based on your knowledge and experience versus the doctors? And
it is a completely other world, I have to tell you.
other
So,
world.
yes, other world. So, there is not much communication. It is based on a completely other set of information as regards the causes of the diseases, and actually the major difference as compared to standard medicine is that standard medicine do not know a cause actually for any disease.
Right.
So if you try to look at the etiology of the disease, in the end, they always say it is idiopathic. We do not know. We do not know the reason. We do know a few things, whether it is more frequent in men or women or the opposite, or if you smoke, then you are more prone to develop this disease. But what is happening if you do not smoke, or you are young or you are old? So these are not real. So these are not real causes of the disease, and they just admit that this is genetic. And this is the blanket answer to anything that they do not actually know. And if we step back, and here comes the evolutionary approach into play. If you step back and see humans as a species that evolution itself brought about, and compare it to other species on Earth, you can see that this is the only species with so many devastating disease and dying from those disease in great numbers in the end, as opposed to, and you can pick any animal, a lion or a zebra or Drosophila, whatever, who do not suffer from such chronic diseases lifelong, and they die a natural death as opposed to humans. And then the next thing, that this was not always that way, that there is a almost exponential increase in the incidence of certain diseases. Diseases start at a younger and younger age. So there has to be an explanation. There has to be a cause for this very strange pattern of phenomenon.
And so, based on your anthropologic background and in what you sort of learned from Lauren Cordain and what your team approach has been, how is it you brought in a change in nutrition from just focusing on vitamins to beginning to engage in a completely new, different protocol?
Would you specify this question?
Sure. Well, yeah, at some point you said 10 years ago you looked at and began to look more at nutrition and Paleolithic diets. And then how did you begin to integrate this in the practice of caring for patients?
Mm-hmm. So I didn't integrate because I did a complete switch to this area, because the two are quite incompatible. As I said, we greatly appreciate the diagnostic part of the current medicine, but when it comes to explaining the causes and the treatment, that is not compatible with almost anything what standard medicine tells us. So we can speak about red meat that has been vilified for decades, organs, animal fat, uric acid, and so on and so forth. So you cannot find too much common ground with standard medicine, and you can debate a lot about cholesterol, back and forth. This is an endless debate. So in my opinion, it's much better to start from the end result. We can see that patients who switch their diet to eating a meat fat based diet can recover. They recover completely. they have a low inflammation level, and the inflammation is a big culprit with any disease. They exhibit very good vitamin levels without taking supplements. So it is much better to go with a positive experience coming from individual practices, even if it is an equal one sample, as it has been done, decades before, if you go back to 100 years earlier or anything like that. They learned from each other, and they move forward based on the positive achievement, the end results. And whether they understood it or not, they always went with a good experience.
Mm-hmm, mm-hmm. And the medical world environment that you're in, how open are they to the nutritional changes? In America, certainly very close-minded. I've been reprimanded from talking about this. My license has been threatened by this. And are you seeing the same type of environment where you are, or not?
Quite similar, quite similar, and not much change in the last 10 years, I have to tell you. But I think here in Europe we have more room. So practitioners have more room. There is something that is called medical freedom. If you're a practitioner, you retain a certain degree of freedom in what you propose to a patient. And it is always the combination of what you are suggesting and the patient is accepting from what you are saying. And then you are supposed to do a common decision. And this is something that is set in the law, in the Hungarian, I think also in the EU law of health care. And you can always go back. So there is some legal grounding for this, but that's another question that everyday healthcare doesn't really care about this. And there are fields that are more difficult, like the diabetology and oncology. I think they're very closed-minded and not too open to nutrition and switching their mind. But maybe others.
So
general practitioners.
But in your 10 years of the Paleolithic and moving more towards this P.K.D. diet, and we'll talk more about that, you're likely seeing a lot more interest over the last 3 to 5 years, or and that part's growing, would you say?
No, I wouldn't say anything like this. So that there is not much openness.
Well, hopefully with the continued conversation, we're going to be able to crack some of this very hardened nuts. Can you talk a little bit about leaky gut and the damage in the bowel, and whether or not that may be sort of the initiator of much of the diseases, and comment about that?
Yeah, so in the intestinal permeability, which is also called the leaky gut phenomenon, is a crucial concept behind the development of autoimmune diseases and cancer. And this theory says us that there are certain food components from our diet that are elevating the intestinal permeability through the disruption of cell-to-cell junctions and communications that help the bowel functioning as a barrier between our gut and the rest of the body. So if we are eating certain food components like grains or many cereals, milk, dairy, nightshades, and there is a long list. then we may be producing a leaky gut, an increased intestinal permeability. And if somebody has an elevated intestinal permeability over years, in some other cases only for a few days or single occasion with a huge elevation in intestinal permeability, they become very prone to develop a certain autoimmune disease. And I'm saying certain because we do see, and others also do see, specific relationship between certain food items and certain autoimmune diseases. But anyway, once they have developed and they have an established autoimmune disease, they are stuck into that autoimmune disease until they do not change their diet as a whole, and also in the right direction, what is needed to be changed.
And our first line is to label a disease and then pick a drug and then treat it based on that and understand sort of the natural history of these diseases, which either end in more drugs or other organ failure and things like that. Is it possible that all the diseases essentially are caused by the same thing, but we just label them differently because that's kind of, we're focused on organ systems in disease labeling?
Diagnostic criteria for diseases can be quite arbitrary. So we do see an increase in the number of autoimmune diseases, 100 every year. So they are defining another autoimmune disease, which is not quite sure that it is indeed a unique and other disease than something that was already defined before. So, and there are many overlapping diseases.
I wonder we just label them as different, but they're not really different. But it's like your car, your brakes go, your carburetor goes, your tires go, the paint job goes. They're still caused by the general inflammatory processes of the environment. And we're same thing for our bodies, but we all have our subspecialties. And so we still like to link them to, something unique and different. Some people will die from a peanut. Some people seem not to die from a peanut, but maybe the peanuts are bad for all of us, but we don't see the same acuteness. So chronic conditions are not different, but the immunologic reaction is different.
Yes, that should be true. The autoimmune process leading to the development of any autoimmune diseases should be very similar. We just do not see that part of that development. We only see the end result.
Right. And so back to epilepsy, because we know that epilepsy, if you look back years, the ketogenic diet was sort of the first line therapy. Did that come into play for your team early on or not?
Yes, I think it was Crohn's disease, which was the most frequent disease when we started, and then there has been almost anything that are in the textbooks. So not specifically epilepsy. Actually, epilepsy is a very difficult disease if you try to cure it with a diet. Because epilepsy patients are taking medicines, and there are a lot of interactions between the diet, between the medicine, and vitamin D, and there are many. And epilepsy patients are very sensitive to anything that is outside of the diet, and this includes anti-epileptic medications, which is, of course, if you can imagine a pill, it is containing 20 chemicals, artificial materials, lactose, sugars, vegetable oils, and these are all provoking the epilepsy. but of course so it can absolutely happen that you completely do the diet and you still see no improvement in the seizures. So it is a vicious circle, and therefore this disease is very, very difficult in most of the cases. So not everybody is that disciplined or can wait out a long time eating a very restrictive diet to see the benefits. So, but it is possible. It is theoretically, it is possible. Those who stick to the diet long enough and went through all the adaptation and tapering down of the medication gradually, slowly, everything, they do see improvements, but sometimes it takes a long time.
Well, maybe you could tell us a little bit about the paleolithic versus ketogenic versus the paleolithic ketogenic diet.
So originally we are coming from the Paleolithic diet, which implies that you shouldn't eat anything that was not available for your ancestors. And as it has been defined by Lauren Corden, it is excluding 6 items. And this is how most people define, or if you look at the published studies, this is how they define the Paleolithic diet. Exclude the six items, but you can still eat vegetables, fruits, artificial sweeteners, yes or no, supplements, yes or no, lean meat, fish, not much organs. So this is how in reality. And we very early find out that applying this diet will not reverse autoimmunity or cancer. Mm-hmm. It may result in benefits, many metabolic benefits, like anything that is related to glucose control, but it will not affect the autoimmunity side. And we found out with my colleague Csaba Tóth at that time that we really have to exclude everything outside meat, fat, organs.
All right.
Okay, we are back.
We got you. We got you. So, I think we were removing and sticking to the meat and organs, right?
Mm-hmm. Yeah. So you need to be very specific with all details with the diet to see the end result that you want to see. So that's why how the Paleolithic ketogenic diet differs from both the Paleolithic and the ketogenic diet. So we had to find a different name that differentiates this diet from the simple regular paleo diet, and this is what we found out. And this was way before the carnivore movement started, so that's why we use this and we stick to this.
So you specifically say meat and fat. I mean, most people say meat, but the problem with meat is that there's either lean meat or medium fatty meat or really fatty meat, but it's a hard one. Even carnivore, the word carnivore is once again animals, but these are all very difficult to understand for a lot of people. Where does keto come into this, your phrase then?
Mm-hmm. So you have to compile a diet that also ensures ketosis in the end, and that's crucial. And this concept actually goes back to somebody who is called Walter Voetlin. He's a gastroenterologist who wrote a book about this in 1975, the Stone Age diet, and he was a practitioner, gastroenterologist. And he described...
Well, it's the beautiful world we live in. It's just the nature of the world. We have to be sort of okay with all of it, right?
Yes.
So,
I don't know what's going on.
It's all good. It's all good. And if for some reason it blanks out, we'll come back another. If it doesn't,
Yes.
Don't worry about it. Don't worry about it.
We just continue, no problem.
We go with the flow. And so
I just wanted to finish that
please,
he was the one who used the term meat fat based diet. So he didn't use carnivore, he didn't use meat diet, he used meat fat based diet, and he was right. He didn't even speak about ketosis. He was not into ketone measurements. It was not that available at that time. He used what he had access to, but he was very sure in saying that this is a meat-fat diet.
And so let's just talk a little bit more about the treatments of the diseases your clinic, which is Paleomedicina.
Yes, ICMNI-Paleomedicina, double word.
Okay, in Hungary, correct? Where is it?
It is in Hungary, but we are accepting international patients online because we moved into the online sphere because of the COVID and everything.
What is the how can they find you online?
They can find us through our website, nutriintervention.com. This is our web page.
And we'll make sure we attach that to this
Thank you.
post for sure. And when did you begin to really start incorporating the P.K.D? Can we just call it P.K.D. diet or P.K.D.
Sure.
into the treatment of cancer, in specific, and other diseases?
Mm-hmm. It was already early on, so almost 10 years ago.
Mm-hmm.
It was not intentionally done so, but as you also know, people who are approaching you do very rarely have only one condition.
Right.
They approach you because of diabetes or because they're obese, but then it turns out that they have a cancer, whatever, and then you start treating them with a P.K.D. for diabetes because you know that it works for diabetes. You may think that you very likely do not harm the cancer disease because you know some background or some studies or anything. And in the end, it turned out that you can control blood glucose and you can control tumor progression too, even if this was not expected in the beginning. So this is how we started collecting experience and long patient histories. And it turned out that wherever we use it, it is efficient if the patient really sticks to the diet. If you have blood works to show that the patient sticks to the diet. And here comes the diagnostic part. You always have to ascertain that the patient is doing what is supposed to do and not something else. And there are so many other factors that patients sometimes feel tempted to combine with the diet approach because they think, okay, 2 approaches is more than 1 approach. But they may be going against each other, and then the end result may not be the best.
So you talk about surgical, chemotherapy, or other medicines along with the nutritional
supplements. Approach. There are supplements. There are crazy plant extracts, antioxidants, whatever that have a very limited evidence that they are working in humans or anywhere. And this is coming from the marketing side, not really from the scientific side. They may be doing harm. So I can tell you an example of an epileptic child who was doing the P.K.D. and he didn't improve. He went on having seizures and he stuck to the diet, and then after a few months it turned out that he's still taking vitamin C because parents thought that if you are eating meat and fat, how do you have vitamin C? So they decided on their own to give him vitamin C supplements on the top of the diet because they thought that's just vitamin C. That's just like water or air or nothing.
Right.
But in reality, that may be doing harm and increasing intestinal permeability. So really goes against what you are doing with the diet, and the end result is not perfect. He
Is it
became seizure-free when stopping the vitamin C too. So it is very tricky when somebody says, I tried, but didn't work for me. You have to be very careful.
so? Is it the vitamin C, the vitamin, or is it the products that come along with it? But ultimately, no animals taking vitamins. I mean, we never took vitamins through the majority of our existence. We didn't
Yeah.
look for vitamins. We ate a meat, fat-based nutrition as hunters, not as grazers, which is our nature.
Yes, exactly. This is exactly how you are saying this. We never had vitamins in an isolated form. You know, you either eat plants or animals or whatever, but you will never eat vitamins in an isolated form. And the other thing is that supplements are containing minerals or vitamins in another version, other form than it is to be found in a plant or in an animal.
Mm.
Like magnesium, you can never find magnesium in the same version than it is to be found in a supplement.
We didn't live in a world of bottles and pills and shots and treatments. So the types of meat that is recommended or products in your nutritional recommendations?
So the basic rule is to eat four-legged animals, big four-legged animals. And this includes pork, beef, sheep, goat, lamb, basically these four. If you are living in Sweden, you can have access to reindeer, or if you live in Canada, so there are other possibilities, but the majority of the people are doing great on this stuff. And the pork is something that is a little bit tricky because pork is fed in another way in the US than in Europe, or specifically in Hungary. The rules are more strict, how you can feed, how you can treat an animal. And that's why there may be differences. Pork is not always of that good quality in the US, but other animals, other four-legged animals are okay.
Iberian ham, pork from Spain.
Yeah, that should be okay or almost okay.
Okay. What about poultry and fish? What is detrimental about it or not recommended?
Mm-hmm. So the overall nutritional density is not as high as in any four-legged animal. If you just look at the color of the fish or the poultry, it is almost white.
Mm-hmm.
It's called white meat, as opposed to red meat. So, and this is because there's a huge difference in the iron content. And the other thing is the fullness of the nutrients. So you will not be able to find too much vitamin C in the fish or poultry or eggs. There is almost zero, if not zero. There is always some vitamin C in the meat and in the organs specifically. So this is the major difference. The nutrient density and the fullness of the nutrient spectrum. And the other thing here is that fishes and poultry can be manipulated to a bigger extent as compared to a beef that is grazing basically only.
And there's less fat in fish and poultry the way we eat it. The white chicken breast and the fillet of fish also is a little bit of a factor.
Yes, it is. It can be a factor.
And what about salt and iodine? Any comments on that in use in when you're eating the meat and do you need an iodine supplement?
Mm-hmm. You do not need to take iodine supplements because you will have iodine from your meat. If you're eating liver, that will be containing iodine. And you do not have to bother too much about calorie tables or nutrient density tables, because it is a better way to look at the blood work. And whenever we look at the blood work, we always see that iodine level is in a good range. If somebody is doing P.K.D in the perfect way. And this is the case with basically every other nutrient. Not vitamin C, but that's another story. But whatever nutrient and ions or minerals you look at the blood level for, you will see that it is in the good range. So there is no need of iodine. And you can ask any nutrient and the answer will be the same. So it is better to approach this question from the whole, from nutrition as a whole, rather from the single nutrients.
What's your thoughts on eggs and milk products?
On what?
Eggs,
Eggs.
and milk products.
Mm-hmm.
Where do they fall into?
So milk and milk product is a no in the P.K.D because of milk protein.
And the same would go for butter?
Yeah, it goes the same for butter because it is still containing some residual, and the same goes for the ghee. Because
So
of the milk protein, and it is very crucial in some diseases. It may not be crucial in others or those who are relatively healthy, but there are certain cases like type 1 diabetes, prostate cancer, breast cancer. These are very closely related to milk protein.
So those that have any disease and are doing P.K.D, using any milk products really should be out.
Yeah, it should be out. It should be out. And eggs can be a part of the P.K.D, but in the starting phase of the P.K.D, we very often suggest avoiding eggs because of several reasons. But the aim is to keep the number of variables as small as possible in the beginning, so that we can achieve result in the shortest possible time.
I was watching a documentary on polar bears once, and polar bears hunt ring seals, but when they can't find them, they will go on the cliffs and eat the eggs of the birds. But that's not their primary desire. They would just love to stick to the ice and find the seals. So maybe that's for us too, in some way, is we couldn't hunt the meat, and we figured out that we could get some chicken eggs, and that held us over in some way. So.
Yes, that should be in that way, because we always hunted for four-legged animals, and the bigger the better. So eggs and poultry is on the other end of the spectrum, because it is just more ecological, energy efficient, take down a huge animal rather than collecting eggs one by one.
The organ meats, and how critical are they versus just the liver, or is that even so critical?
Yeah, so the number one organ meat is the liver, and we suggest to eat brain or bone marrow in addition, and that's all what is needed to be done on the organ meat side. You can do anything else, but liver and brain or bone marrow is a must if you want to include the entirety of the nutrients. Otherwise, you may miss something out of the nutrients.
So getting all three of those is important versus just the liver, would you say?
No, the brain and the bone marrow are alternatives.
Alternatives, but not critical.
One of them is critical.
Okay, any one of those.
Anyone, yes.
Okay, all right. And maybe you tell us a little bit about fasting in the P.K.D approach, or just in general for humans.
We do not use fasting. We do not recommend it on any basis. But it depends how you define fasting, because a lot of people who eat once a day think that they fast for 24 hours, which is true actually, But if you are eating P.K.D, then it is just a normal meal rhythm. It is not anything beyond a normal meal rhythm. In my understanding, fasting is that you prolong, you go way farther than you would like to otherwise.
I mean, so most people in the world, I don't know, most people in the world, I mean, we probably didn't eat more than one meal a day or less for millions of years, I imagine. But
Yes.
we're today eating at least two, if not three, many parts of the world.
Yes.
Does that, so that's not built into the P.K.D approach?
The first suggestion is to eat twice a day, and that is usually enough for anybody. And there are ones who eat only once a day. And you know, it is depending on the specific situation. Sometimes, very rarely, there are occasions that somebody is very undernourished, or the stomach has removed, or something that is a very specific condition that requires that they eat 3 times a day. But that's a minority of the other cases. But we do not suggest fasting in general, because anything that is to be achieved by fasting, you can achieve by the P.K.D alone. So they claim that you can get a glucose control with fasting, but you can get a glucose control with a P.K.D because it's a low-carb diet. They say that you can achieve inflammation control, but you can achieve it with a P.K.D too. So we do not see any major benefit from fasting. And in some cases with patients, it can also be detrimental, because you need nutrients. You need nutrient intake. If you are anemic, for example, and you stop eating red meat, you can worsen your anemia or vitamin D or anything.
Is rare better than well done meats? Is there more value to raw or rare meats versus?
Yeah, to some degree, yes. To some degree, it is less if something is less cooked. But it doesn't make a very big difference.
And I hear about a cookbook, and are you
Yes.
coming out with a cookbook? Maybe tell us a little bit about it.
Yes, it came out in September.
Oh.
I can show you. This is with me. So this cookbook was put together by Natalie Daniels, who is our nutritional assistant. She is the one who helps patients with the diet and how to effectuate the diet in a proper way. And she's the one who put together this book. It is containing 85 recipes. And I can tell you that each recipe is very distinctly different from the other ones. So this is not just a steak and eggs book. There is a variability of different meats, and there's a lot of creativity in the book, and includes a lot of organ meats, which is something that patients wanted to see, because since they do not have a background or any knowledge how to deal with brain, or this is not something that we were brought together. So this is not coming from our culture. Or
is it found on Amazon or your website?
No, it is on our website only right now, so it is available there.
Well, we'll add a link to that on our website also. That'd
Thank
be
you.
because we all love the culture of food, which is probably the biggest challenge for most people in this world, because our social cultural norms are variety and fruits and vegetables. How do you approach that in helping people get to the level they need to be?
So our patients are usually coming from the carnivore society, or ketogenic low carb. So they are a little bit prepared already. So they are already not eating everything. So they did a little bit of research or anything like that. So they're just happy if we are able to provide them recipes or anything. But there may be real cultural differences, because Western countries and the US more so, is very far-fetched from our evolutionary adapted diet. And here in Hungary or in Central Europe, we still have our roots to this ancient gastronomy. So it is still part of the culture. We were still eating grazy breads when we were children. But we know what pork fat is, or we know what liver is. So it is not that far from our culture, but this may be completely different in another country.
Do you think the problem can be solved by sticking in with mostly a P.K.D. Nutritional plan for much of us, most of our lives, but then from time to time having that gastronomic adventure? But the problem is we made a party every day instead of those holidays once in a while.
Yeah, so the social factor is a big thing here, because everybody likes to eat together with a family or friends, party, going out, restaurant. This is what we are enculturated, and this is not doable, or you may have difficulties with doing this. But hopefully things will change, as there are, I guess, many vegetarian places, vegetarian restaurants, vegetarian shops to offer something for those who are vegetarians. I think the same will happen for low carb or carnivore meat eaters. It is depending on the customer choices, as with anything else, I guess.
So would we really say that our traditional diets currently are the cause of disease?
Yes, that's for
And
sure.
the cure of these diseases is simply going back to a Stone Age meat, fat based nutrition and staying away from fruits or vegetables or milk products, cheeses, obviously, of any significance or frequency.
Yes. This is basically as simple as said, but sometimes it's difficult to do it in our real lives, but it is doable.
And if you have no suffering diseases, this nutritional advice is really for everyone.
Yes, this is for everyone, because should be still interested in preventing the conditions that other people die in, and everybody wants to live a long and healthy life without diseases. Specifically, if you had somebody who suffers such a disease in your family, and see those loved ones helpless, or suffering from side effects of chemotherapy or medication, then you may have an additional motive to not to get there, because you have already seen it.
Plants are potentially harmful and toxic to us. Is that the basic?
Yes, plants are our enemies. Plants are packed with various anti-nutrients, lectins, and this is part of a very long struggle evolutionary between plants and animals, because animals can run, can hide to save their lives. Plants cannot do this, so they are producing chemicals to save their lives, and these chemicals are produced against pathogens, viruses, and also against grazing animals to some degree, and also against humans. So these are just pharmaceutical weapons that are stored in plants.
Coffee, tea, and alcohol. I'm assuming that you agree that they're also out. of any
Yes, in the most
significance or
strict
frequency?
version of the P.K.D, all three are out. Alcohol is out in the first place, of course. And then the next thing to get out with is the tea. There are differences, huge differences actually, when it comes to tea. And the same goes for the coffee. But maybe the coffee is the least detrimental out of the three. So coffee may be a compromise for somebody who is relatively healthy or already did a huge recovery and almost close to being healthy. Then it may be a compromise.
I've been off coffee now for 4.5 months.
Congratulations.
And I don't generally drink tea, but I had it the last 2 days because I've been having a scratchy throat. But again, it's been my temporary medicine. But I'm feeling better now, so I'm done. And but it is all they're drugs, essentially.
Yes, sure. It is just the concentration what makes a drug, as we know.
And I don't remember if you said anything about salt. Are we able to use it reasonably liberally, or should we not use it, or it's okay, but don't go crazy?
Usually you can follow your cravings and eat according to your cravings. So it will just adjust in a natural way. You do not have to think too much about it, or do not have to push yourself into using more salt or eliminating salt entirely. Just follow your cravings. And with any low carb diet, you usually crave less salt because less salt is needed. The more carbohydrate you eat, the more salt you crave for. So it is not independent of your diet. It is also part of the big picture.
So just to ask sort of a open question about your purpose and mission in sharing what you share. Maybe you can just tell us a little bit about what drives you to share this completely opposite in much of the world, in science and medicine is not sort of open to all of this.
I do not know. I love people. I love research work. I love science. I like doing science, doing analysis, calculations, everything. I'm into science very much. I like it, and it is just the consequence of the scientific results that it has a human application, and why not use if you already have those data, and why not use if we can help other people to benefit, because I am benefiting a lot from this data, but you have your family, you have your close friend circle, and you have other people around you. Why not help them if you can do it?
Do you live on this nutritional plan, by the way?
Yes, of course.
Is there anything?
Everybody or anybody who wants to join has to follow this diet. Otherwise, it's not working because it's just.
So if you're passionate about life, this nutritional plan lifestyle is a game changer.
Yes, definitely. Helps your mood, helps your well-being, psychological balance. You are more resilient, whatever is happening in your life, because you do not really have a full control of what is happening to you, the society, economy, politics, whatever. But you can gain a good control over your health and mental stability, resilience. So you can really benefit lifelong from this diet.
We're likely brewing beer in our bellies via a plant-based diet, right? Fermentation in the gut.
Yes.
Right? Is that a significant problem, do you think?
Yes, it is part of the problem. Yes.
And so I'm assuming if we don't need minerals, we don't need vitamins, we probably don't need probiotics.
Yeah, definitely. You do not need it.
Is there anything else I didn't ask that you wanted to share And maybe you can repeat the clinic and your website also.
Mm-hmm. I could speak hours and hours.
Yes, me too.
Maybe that's enough, because otherwise it is too much to digest. But the main message is just you have to get back to what you are designed to eat, and then a lot of things will be fixed in your lives. So you do not even have to understand the biochemistry or any specific medical result or data. Just do what you are supposed to eat and look at your blood work. Inflammation level is low or not, how you feel. So go with these feedbacks. And if you have time or interested, you can do further research. We regularly publish, sometimes single case studies, sometimes group studies. I would be willing to publish more because this is my primary background. I love putting studies together. I just do not have the time. But I will be doing this in the future, I hope so. And again, the webpage is nutriintervention.com, or you can find me on Twitter under my name. So there are quite much unpublished research, blood works, and data that I post on a regular basis.
Well, we're going to continue to follow you, Dr. Clemens, and we so appreciate your energy, your passion, and love to have you on maybe for a live Q&A with some of our community. But would look forward to it. So thank you so much for taking.
Thank you very much, Robert. It was a pleasure.
Zsofia, God bless you. We look forward to
Bye-bye.
talking to you soon. Okay, take care.
Bye-bye.
Bye-bye.